Good morning, everyone. Really nice to be here. We'll go ahead and just start with some quick introductions and then go ahead and move us forward. My name is Heather Gillich, and I work with the Minneapolis Health Department as the manager of the Healthy Living Initiative. And I'm here with two of my colleagues from the project that we'll be presenting about. I'll go ahead and let them quickly introduce themselves before we move forward here.
Hi, my name is Farhiya. My name is Farah. I am part of the SPAC project, and I'm the program director at St. Mary's University, and I'm also assistant professor there.
And my name is April Graves. I work with Heather at the Minneapolis Health Department in the Office of Violence Prevention, and I'm a public health specialist, youth violence prevention associate.
We'd love to just, go ahead.
Pronouns, she, her, hers.
We'd like to just quickly get a read on who's in the room here. So if we can just use the chat here for some quick introductions. If you just take 1 second to put some of this information into the chat here so we can get an idea of who's having this conversation with us. Excellent. Thanks, everyone. Go ahead and kind of keep those going. And we just wanted to start with one quick kind of word around how you're showing up this morning so we can do some level setting. It's been a really important part of our work around activating shared power within our COVID-19 response to just check in with ourselves. And you'll kind of see that we'll go through this here. So I'll just say that I am adequately caffeinated and excited. Too many words. Maybe April, Farhiya, if you want to share how you're showing up this morning too.
I'm showing up grateful this morning. As you all know, this is the month of Ramadan, spiritually intense, very grateful.
Yeah, and I'll say relaxed. I feel the sun shining on my back and it just feels amazing. So I'm hoping to continue to feel that way throughout the presentation.
Awesome. So just to do some objective setting, we want to share here that we're going to try to move through a really big and complicated project pretty quickly, but we also want to make sure that we have a lot of time for an engaging conversation. So we're going to replicate a model that we used during part of our Shared Power Advisory Committee work in order to help garner some understanding from the group about how it felt a little for us to go through that process. So we'll go ahead and do a quick kind of case study overview of the project and then move through some exploration and practice and then close us out with some reflections here. So before we get too far in here, to begin kind of replicating how we went through this space, I'll turn it over to you, April, to do a quick grounding exercise with us.
Thank you, Heather. So yeah, one thing that we did during the 8 weeks that we met with the Shared Power Advisory Committee was at every meeting, we would, kind of check in with each other and then do a grounding exercise. It was really intense time period with, the pandemic just kind of getting started. And then also during that time frame, we experienced the murder of George Floyd and civil unrest. And so it became very important as a group of diverse community members to have some space to ground ourselves. And I think that remains true now. So I'm just going to invite all of you to relax your shoulders. You can close your eyes if that feels good. And just notice your breath. Notice where the ground is supporting your body or the chair is supporting your body. And just take a moment to reflect on a time when you felt safe, welcomed, and authentically connected with another person. I want you to reflect on how power was held and exchanged in those interactions. What do you notice in your body? What do you notice about your breath or your heartbeat? Just continue to take nice deep inhales and exhales. Imagine that the breath is bringing revitalized energy into your mind, your body, your spirit. Energy helping your heartbeat to be strong and steady. Energy helping your blood to flow smoothly and evenly. And energy that helps your thinking to be more clear and focused. As we continue through our presentation, please make sure to take time for yourself, to breathe, to ground, to center yourself in your space. And I hope that you find the space is welcoming and that you can show up authentically as yourself. Thank you.
Thank you so much, April. This work is inspiring, but complicated and really hard on our critical thinking skills and our emotions. So it's really important to take that time. And I am so appreciative of this group of folks that we've been able to do the project with to keep us all centered and yet moving forward. So I'll take a few minutes here from the kind of staffing perspective to give you a little bit of an overview of how we got to the space where a shared power advisory committee felt like the right solution to moving forward and activating shared power in the incident management team response to COVID-19 and its in the early months of the response. And then we'll pass it over and Farhiya will give us some of the perspective of kind of how it felt to be in that space outside of the Minneapolis Health Department. So initially, April and I were tasked with kind of trying to figure out what does community engagement and empowerment look like in collaboration for planning and reacting to this very new environment that we were operating in. And so the first thing that we did was really to take some time to work and think about how we could identify some of the core competencies and the guiding and driving principles for our work. So really focusing intentionally on hope and healing, creating a community sense of belonging and centering well-being in the work, but also moving forward toward policy initiatives and advocacy. How are we going to make systemic change? How are we going to make sure that what we were focusing on amplified community voice in a meaningful way and shared power in the decision-making structure so that moving forward, we weren't just representing community voices, but we were actually sharing power with community to represent themselves in spaces that we had access to. Really focusing on education and awareness, kind of knowing that the situation was ever evolving and that we have all been learning in this space together. It was important that we focused on our own staff goals and the goals of the incident management response, but also on making sure that we were supporting folks who were doing the work outside of the infrastructure of public health. Another big component of the work was trying to figure out what resources were out there and really taking an asset-based approach to our shared power and community engagement efforts. So really trying to figure out what our process was going to look like. This is a little bit of sort of how we figured out what we were doing. Initially, our structure started by having a an 8-week set. We really wanted to focus on something that had quick objectives where we were setting goals for the group, but also allowing the group some autonomy and setting agendas and figuring out what was going to be important without a staff directive to say, this is what we need from you. And so the structure really included a robust support from staff members across the city enterprise, even outside of public health, to really make sure that we could support each other as staff and support everyone who was a part of the project with us from community. It was a really important part of making this work, and one of professionally the most empowering spaces that I have been in within the health department. Our activation group became a real grounding space for us as staff, and a space for us to really process all of the intensity that was happening there. We also really wanted to focus on creating some authentic leadership engagement. So in addition to having support staff driving some of this work, we also really focused on making sure that we had representation from our city council and also from our health department and incident management team. So the structure of our meetings were that we actually had 2 meetings every week for 8 weeks. We did take a pause around the murder of George Floyd to be very present and intentional and hold space for community members who were a part of our Shared Power Advisory Committee, but we ended up extending our time a bit to accommodate how intense that was. But our structure of having a planning meeting ahead of a presentation meeting meant that we had leadership from the city a part of the presentation meeting, and the planning meetings were really a time to identify priorities and focus on figuring out what the community really needed to say to leadership, and then moved us forward in having all these meetings that were really intentional at creating a feedback and action loop. We'll kind of get into a little bit later sort of what it felt like to run into some of the barriers that we had as far as the ideas that came forward and what power we really had to share, or what actions we were actually able to take, both from our staff perspective and from the perspective of our leaders during that time. We did really want to be intentional about making sure that this model was something that could be used in the future and that we could be iterative about. So we did a very intense debrief with hot washes, interviews, and surveys after the fact, so that we could use that time to both ground us in what went well and what didn't go well, and to move forward with making those changes if we applied the model in a different space. So Farhiya, I'll go ahead and pass it over to you for your perspectives as well.
Sure. You're gonna move to the next slide?
Yes.
Okay, good. All right, so before I even talk about my slide, I think it's important that we all realize the time period that the SPAC, the Shared Power Advisory Committee started. It started right at the onset of around the first 60-90 days of COVID, when it hit our communities. And it's a time of it was a time of high anxiety. There was a lot of dread, a lot of unknown. And 1 year passed, we're in April, when you look at what happened between that April and this April, and the number of people that have the mortality that has happened within our own community really justifies the anxiety and the dread we all felt at that time. So we talk about recruitment. As a member of the Shared Power Advisory Committee, I was actually invited by one of the Minneapolis Health Department employees, and I was working with the City of Riverside, a community-based organization located at City of Riverside as an advisor, public health advisor. And it is during those dialogues and trying to solicit some resources for the community there that I was asked, do you want to participate, be a member of the Shared Power Advisory Committee? And I agreed, and an official email was sent that clearly articulated the charge. And I think it's very important that there's clarity as to what it is that is being asked. And the charge really was to advise the health commissioner and also some of the city leaders in response to COVID-19 particularly focusing on the needs and concern of the city's most marginalized residents, including Black, Indigenous, people of color, immigrant renters, LGBTQ plus, the youth, persons with disability, labor rights, and those impacted by the criminal justice system. So I agreed to participate, and we were several, I don't remember exactly how many. The numbers, were not very consistently increased, but we were almost 20, I think, members, right, who participated. What we were asked is to be part of an 8 weeks commitment. The 8 weeks involved a 2-hour planning discussion meeting with the group, and also reserve an hour presentation with the commissioner or other city leaders who were able to join us. So it was 3 hours, lasted for 30 to 6:30. And these dialogues were very, very intense, and as you can see, it was it was more than 2 hours, and there was a lot that has happened during that time. A memorandum of understanding was signed by all participants who were interested, that committed to participating in the weekly meeting, but agreed to developing a collective action plan detailing all the functions and the scope, implementing necessary action steps between meetings, obtaining approval of all communication materials developed, and also the opportunity to perhaps educate city officials. So once the participation, there's a shared understanding of what the members of the SPARC were expected of, the meetings started. And during that meeting, there was a strong collegiality really that I've observed between members themselves, and also between members and city employees. And particularly, there was a collaborative spirit. April and Heather and her colleagues will ask, do you want to facilitate these meetings? Do you want to lead agenda formation? Do you want to, they asked if we're interested in presenting opportunities for co-facilitating. There were many actions that came out of these initiatives. And of particular, we had a running table, and also color-coded, that fell into different categories that actually were direct response from the many dialogues that took place. Some of the various specific outcomes were related to communication, cultural specific responses. Examples of communication, for instance, is partnership with community-based organizations to deliver prevention through education, cultural specific responses, data and distribution. For instance, there was request for differentiating services within the BIPOC community. There were public safety concerns. There were direct resources requests, for instance, low-income elders in low-income areas lacking essentials. These discussions came up many times. There were specific health-related mental health resource and support requests, social emotional health for use, for instance, testing and tracking and communicating, especially in marginalized community. There was also underutilized community resources, businesses and community organizations that were underutilized, some business technical assistance requests, and also feedback from the city, air pollution items and other, we'll talk about later, that came up. So there was a broad range of topics and interests and priorities that the communities brought out to these meetings that required a response from the health department and also a response from city leaders. And the commissioner joined us, and she answered a lot of these questions. And the ones that she was able to facilitate within the city. For instance, other city units, as Heather will see, that are not necessarily public health, but they were able to jump in and to answer a lot of these questions. Situational updates were provided in every meeting, for instance, number of cases and deaths in the city, and also epidemiologist staff were invited to present information and answer a lot of the questions we had. There were also health incident command updates, and numerous issues were measured and regularly reported during these meetings. As far as areas of tension, I think I will reserve this to my concluding remarks, and I will let April go to the next slide.
Thank you, Farhiya. So as you heard, there was a lot that came out of these 8 or 9 weeks of meetings with community members and city leadership. And one of the tools that we used was something called the technology of participation. So, and I think maybe our second or third meeting, we use this facilitation method, the technology of participation, which uses a framework that is called ORID, to get at objective, reflective, interpretive, and decisional level questions. And really, the technology of participation is a facilitation measure that's really applicable in any kind of setting where you want to get a group to make a collective decision or a collective understanding or plan. Oh, excuse me. Of course, as soon as I have to talk, my phone starts ringing. Sorry. So we use this ORID framework to really ask the question of how we should be responding to the COVID-19 crisis. And so these different levels of questions, the objective levels really trying to get at, what are the facts or what are the observations that you could make on a specific action item. And then our question here for today is going to be how we can amplify community voice and share power in emergency crisis response. So we're going to actually kind of go through like a shortened version of a consensus workshop or focused conversation. When you do a consensus workshop, you thematically group answers to some of these questions, and each person gets an opportunity to have their words and their voice and their ideas be part of that conversation. And then as a group, you work to sort of thematically clump those words into themes. And then based on that, you can see underneath these different themes, all the different voices and ideas about, how do we move forward on this particular issue. So I think the best way to really learn it is by experiencing it. So the majority of the next few minutes is going to be that opportunity for you participants to do that with us. So the first kind of questions that I want us to reflect on, and you don't have to answer all of these questions, just answer the one that maybe resonates with you most or that you feel like you have the most to speak about. And I'd encourage you to try to keep your answers to about 3 to 5 words so that it's a little bit easier for us to see what you have to say and see what others have to say. So the first kind of objective questions we have to answer this question about how we share power is, what do you notice about spaces that are culturally homogenous? Or what do you notice about spaces that are culturally inclusive? What are some of the things that you see, smell, hear, taste, or touch? And what stands out to you? What's like a key word that would stay with you about these spaces? And so I invite all of you to either put your ideas in the chat or take yourself off mute and share verbally. There's also in the chat a Jamboard link that Heather has shared that will show up on the screen here. If you click on that link, you can add it directly to the screen. So again, I'll share just a couple of those questions and feel free to answer whichever ones you feel most compelled to. What do you notice about spaces that are culturally homogenous? What do you notice about spaces that are culturally inclusive? What do you see, smell, hear, taste, and touch? What stands out to you? What key words stay with you? And I'll just give everybody a few minutes to think on that and potentially add your comments to the Jamboard, the chat, or if you can't figure either of those things out, feel free to come off mute and share your ideas. So from Julie, she says, culturally inclusive results are much more diverse. Absolutely. Tamaria, I hope I said your name right, said there are people of color in these spaces, which makes me feel more comfortable. Absolutely. Absolutely. We also have some people saying, I may see things that are unfamiliar. That's true as well. It depends very much on sort of our own experience and perspective. You know, one of the things that I think about, I see in places that are oftentimes more culturally inclusive is things that are just more colorful, more diverse clothing, depending on if it's like, you know, if there's food available, there might be lots of different kinds of smells. So somebody else said, diverse groups make me feel more relaxed. Culturally inclusive spaces have welcoming spaces and wall decor. Absolutely, yeah, art. You hear more voices and more opinions that are different than your own. Absolutely. Okay, so someone else said, I love spicy food, so I smell different spices. Exactly. You know, it's kind of like a, you know, taking a world tour in one space in some cases. And so we get an opportunity to really learn about other people, but also learn about ourselves in those contexts. All right, we'll move to the next set of questions, and these are going to be more reflective. So those ones are really just like about your observations. This is about sort of more so what you feel, or it's got more of an emotional component to it. And this part of the conversation is especially important because if you don't give people space to sort of process what they're feeling, it makes it a lot more difficult to come to the decisional level of sort of action planning and steps. We need to make space for people to feel what they feel. And we need to be willing to sort of be open and receptive to listening. So some of the reflective questions I want you to think about, and you can answer any of these as well, is to reflect on a time when you felt you were accepted and belonged. Reflect on a time where you felt excluded or isolated. You know, how were those different? How did that show up differently in your body? And what was different about these experiences? What made you feel you belonged? I mean, sometimes I think we over intellectualize, but our bodies can be really important tools to teach us about what we're feeling and how to move through different situations. You know, a lot of the time anxiety and worry is held in your stomach, and people feel, you know, butterflies or feel nauseous, that kind of thing. And those are really important warning signals for us, but also I think sometimes we get stuck in those spaces, especially if it's a space that we don't feel comfortable in or that is a little bit more foreign to us. So starting to recognize some of those things can be really important. So I encourage you to just go ahead, just like we did for the last slide, either come off mute or use the Jamboard or put in the chat just some different ideas about ways that you felt you've belonged, you know, different times when you maybe didn't feel like you did, where you felt more excluded or isolated. And sort of what are the different things that made you feel appreciated, and what kind of role that power might have played in those interactions. So someone said, I felt and shared gratitude. Yeah, and if someone's uncomfortable, they might get quiet or hypervigilant. Those are really common responses, survival responses, right? You can either kind of freeze or close up, or you could, you know, become angry and be much more likely to lash out or say something that maybe you don't mean, or in a way that you don't mean to say it. Because sometimes we mean things, but we didn't necessarily use it in our words in the best way. And that's understandable as well when you're in survival mode. Someone else said, I felt heard by the group. For example, nods from everyone while sitting in a circle, feeling accepted made me feel happy. Those are really great examples, actually. I think eye contact, nodding, and even just this, the space of being in a circle, being able to see each other's faces and be on the same level is really important. Recently, you know, in one of my other leadership positions, I helped host a town hall. And rather than sort of staying behind the stage, we went out and sat with the audience so that they felt as though we were more a part of listening to them and not like having this table barrier between the community and ourselves. So someone else also shared, many years ago, I went to a sports store up north and I was the only Black person. I was instantly alert and I felt a tension in my body. The people I interacted with were very nice, but being the only Black person anywhere activates you in a sense. I agree 100%, especially, you know, in Minnesota. I go camping a lot with my kids, and um, I definitely am more cautious in areas that I'm not as familiar with. It feels better if I have like family in the area, so then I feel a little bit safer, but um, definitely feel you on that. There's definitely been times where I felt like most people are like, well, Black people don't go camping. I'm like, well, yeah, we do actually. You know, we love being outside too, and everybody should feel welcome in our state parks, but maybe sometimes they don't. And I know why that would be. So someone else said simple eye contact by the facilitator makes me feel a sense of belonging. I agree, you know, and even when I think the facilitators appreciate getting eye contact and feeling like, you know, they're being heard and they're making space for other people to feel heard and that they're connected to the conversation and the issues that we're discussing. All right, next slide. Now we move into the interpretive level. So you can start to think about, you know, so what does this actually mean to us? So some different questions that we sort of came up with in the interpretive level were, what ways does vulnerability show up or is acknowledged in spaces of shared power? So like, what does that mean to be vulnerable and why would that be important? How do feelings of acceptance and belonging help create authentic connections between people? And why is understanding things like culture and compassion important? The last presenter that you guys just listened to was talking about the importance of having empathy. So how could knowing and practicing these things be useful to building shared power and decision making? And we're running a little bit short on time, so I encourage everybody just go ahead, whatever your first thoughts are, put them on the Jamboard, throw them in the chat, and then we'll move on to the decisional level questions. And you can also answer the final question about what are some possible opportunities or limitations of creating these spaces, because even though they're important, they're not always easy to hold that space, you know, especially we're all humans, right? And someone might be stuck in the reflective emotional kind of level while the rest of us are kind of already moving on to interpreting the meaning or wanting to take action steps. And so that's why it's important to have sort of these frameworks and ground rules where people allow others to show up where they're at, and that we have the supports in place to sort of frame our responses in the context of a larger discussion and solution building. So someone said allowing to be vulnerable opens doors for authentic relationship. Absolutely. And I apologize if you guys hear that noise in the background. They're actually doing construction outside my house. Do we have any other interpretive level answers that anybody would like to share? If not, we'll move on to the decisional level. And I have to say, you know, we're moving through this really fast. Typically, a focused conversation or consensus workshop using the technology of participation would be something that would take at least an hour, preferably more like an hour and a half, to really make sure you're getting the voices of everybody in the room included and to have more time to do a deeper dive. But, you know, time constraints today, it gives you an idea and you'll have a list of resources at the end of our presentation. So finally, coming to the decisional level of the model, we're asking sort of what themes have emerged for you in this conversation that we're having with each other today. What themes have emerged? And what does it mean to you to have this understanding? If you didn't have it before, what did you kind of learn and what are you taking away today? What specific actions will you take to share power and elevate community voice? Or how can you apply this knowledge professionally or personally? Because I think, you know, the more we practice these kinds of things, personally and professionally, the better we're going to actually have healthy relationships in different contexts and also help other people create that kind of space in their relationships and in their professions as well. And also thinking about what other resources you might need or where your first steps might be. So I encourage all of you to go ahead and, okay, maybe we should just move on to the next part because I'm seeing a message of a 3-minute warning. So let's maybe move on. Oh, there we go. Let's read that. Use my privilege to help others feel included and understood. I need to hear and acknowledge other people's experiences and perceptions. Absolutely. Thanks, Heather. Well, let's move on to the last few slides so we can try to get to wrap things up and before they close the breakout session on us.
Yes, okay. So I'll zip through this very quickly. There were a lot of dialogues, and if I were to boil it down, the issues that were measured, that we wanted the city to measure, some of the recommendations that we provided actually broadly fell under public safety, criminalization, and over-policing issues. Lots of requests for direct resources, and also on specific Medicare element. For instance, what is the racial ethnic breakdown of who is being turned away, sent to manage at home when they were diagnosed with COVID? How many BIPOC communities are not seeking treatment and why? How is the crisis impacting access to maternal health care for BIPOC community? How is the crisis impacting access to non-COVID-19 healthcare for BIPOC community? How is increased need for mental health within BIPOC communities being addressed by the city? Very intense questions and that were brought up, and priorities by the members to the city officials. The major outcomes actually letters. The SPAC committee put together a letter, a consensus letter, and we were asking for the policy changes within Minneapolis Police Department to develop a community review process to ensure impacted community members, specifically Black, Indigenous, people of color, have influence on the outcome. The other letter was actually a request for during George Floyd's murder, the drive-throughs that were shut down. There was, pharmacies. A lot of our communities here could not access pharmacies. They were closed, and we wanted a reinstatement of drive-through pharmacy. That was an urgent request. So those are two major letters that were actually sent to the City Council by the SPAC. Just to finish up with areas of tension, I wish we had more time to talk about this. When we bring community members and we ask community members to be part of a shared power, there is a various levels of understanding what that really means. The folks who are community members who came in, if you're a community member coming in as an employee of an organization's dynamic and expectation is completely different from a freelancer who is an advocate, community advocate, who is coming in and as a member. Their needs are different, their availabilities are different. And this is something that I felt throughout